In this episode of the Nurse Practitioner Podcast, Dr. Denise Felsenstein discusses stress management. Thanks so much for taking the time to chat with us today.
Hi, thank you for having me on the podcast.
What is stress and how does it affect patient care?
Thank you so much for asking this question. Stress is a result of a person's fight or flight physiologic response. It initiates when somebody is in a stress-related situation like life-threatening. And when an individual experiences stress, the amygdala in the brain identifies fear and it alerts the hypothalamus. Then this initiates the sympathetic nervous system to activate the pituitary glands to release ACTH hormone, or the adrenocorticotropic hormone, to initiate the adrenal glands to release stress-related hormones, such as epinephrine, norepinephrine, and cortisol. These hormones continue to be released until the amygdala identifies that the threat has been resolved, and the hypothalamus then stops initiating the physiologic cascade of the whole stress response. The stress response causes many physiologic changes, such as increasing blood pressure, heart rate, and respiratory rate, in order to fight or flee for survival. The response reduces gastrointestinal activity and inhibits the immune system from working to its optimal level. This in turn can cause illness if the stress response occurs over a lengthy period of time. The stress response is meant for a short-term situation to mobilize the body's resources to save an individual's life in a life-threatening situation. Individuals are not meant to be in a stress response situation for long periods of time, since the body's resources are quickly depleted. Patient care can be improved when nurse practitioners ask about patients' stress level and advises them that high levels of stress or long-term stress can negatively impact their overall health. The longer that the stress-related symptoms occur and the hormones are released, then there's more tendency for that patient to have stress-related illnesses. The body systems are negatively impacted with long-term stress responses, such as with the immune system, gastrointestinal system, and cardiovascular system. Nurse practitioners can teach patients about the stress response activation symptoms so that patients can start practicing stress prevention and reduction techniques to help improve their overall health and their feelings of well-being.
Thanks so much for sharing those insights. How does stress affect nurse practitioners when providing patient care in their workplace?
Well, for patients, a stress response occurs when they perceive fear or a type of a stress. Patients can experience stress-related symptoms when they enter a healthcare facility, depending on if they perceive fear or if they perceive a threat of some type. Well, this can be related to either their personal health situation or to a previous negative experience with healthcare systems or providers that have occurred in the past. It's important for nurse practitioners to teach patients about being cognizant of their stress levels so that they can use stress reduction interventions to assist their body to shift from activating their sympathetic nervous system to activating their parasympathetic nervous system. Now, the sympathetic nervous system is what it causes all these stress responses, such as your heart to beat faster, your breathing rate to increase, the blood pressure to increase. But the parasympathetic nervous system turns off that stress response and allows for relaxation and assists the body to recover. It allows the body to go into what we call homeostasis. This is where the body recoups those resources that were lost and heals the body. If the nurse practitioner can assist the patient with relaxation measures in the healthcare facility, then the patient will be able to think more clearly and gain greater understanding of the nurse practitioner's recommendations and care. This will help the patient have a better overall experience with the healthcare visit by lowering their stress. The American Institute of Stress has identified the following health-related issues that are due to stress, such as issues with sexuality and fertility. For men under chronic stress, they can experience impotence, lower levels of testosterone, and a reduction in sperm production. There's also sleep difficulties that can occur from stress. According to the American Institute of Stress, there is insomnia that occurs with increased stress, with 19% of individuals aged 25 to 64 that state that they lose sleep a few nights per week due to stress. And muscle tension. Chronic muscle tension causes headaches, back pain, shoulder pain, and body aches that occur due to stress. The American Institute of Stress is a great resource for information and also identifies information such as workplace stress. They state that 83% of workers say they suffer from daily work-related stress. Monetary costs in the U.S. are over $300 billion in losses due to job absenteeism, workplace accidents, and reduced worker productivity.
Thanks for highlighting how stress can deeply affect the well-being of both the patient and nurse practitioner. Why is it important for nurse practitioners to learn stress management strategies?
Nurse practitioners can implement strategies for patient care to improve patient satisfaction and health-related outcomes. Nurse practitioners can create an environment in their healthcare setting that is less stressful and more conducive to positive patient interactions and comfort. Implementing stress management strategies during patient care can mitigate the toll that stress has on patients during their visit. This will help reduce stress responses when they arrive for their next visit in the healthcare setting. Nurse practitioners can teach stress prevention and reduction strategies to their patients to help them reduce their stress and improve their well-being.
Thanks again for sharing those insights. What strategies do you recommend that nurse practitioners integrate into their practice?
I recommend that nurse practitioners learn how to perform breathing techniques, mindfulness meditation, guided imagery, and use of humor. Breathing techniques are very easy to use and quick to help reduce a high level of stress in an immediate time frame. For example, I used the strategy with a patient that came into the clinic with a high level of stress who was yelling at the staff that they needed help. But they couldn't understand what the problem was and couldn't understand how they can help him. So they asked me for assistance while I was seeing another patient. I excused myself from the current situation with the first patient and quickly assessed the situation with the anxious patient in the waiting area. I asked this anxious patient to look at me and to start breathing with me in a slow and steady pattern. He followed my directions to breathe with me, and then I initiated the square box breathing technique to slow down his breathing rate to the point that he was able to speak in a coherent manner. When the breathing rate is reduced, the heart rate and stress levels reduce as well. So when this was accomplished, it allowed this patient to sit down and then to clearly explain the problem so that we could understand the issue and provide him with the appropriate health care. This is one example of how to use a stress reduction technique during patient care. To learn how to implement breathing techniques and other stress reduction strategies for patient care, please refer to the Nurse Practitioner Journal's February 2024 issue for the article that I authored titled Stress Management Strategies for NP Practice.
That's an interesting variety of approaches our NP listeners can take. Can you explain how nurse practitioners can use these interventions in their practice setting?
Sure. I'll start with breathing techniques. Diaphragmatic breathing can be used by inhaling through the nose and exhaling through the mouth. The abdomen should rise up with inhalation, and then with an exhalation, the abdomen should return to a relaxed position. This can be performed in a lying, sitting, or a standing position. This increases oxygenation by bringing air down into the lower lobes of the lungs, by moving the diaphragm into a downward position, pulling the air down to those lower areas of the lungs. And next, you can try Foursquare or box breathing. For this intervention, inhale to the count of 4, hold to the count of 4, exhale slowly to the count of 4, and then relax or hold to the count of 4. So imagine a box. So inhale for one side to the count of 4, through the nose, 1, 2, 3, 4. Then hold your breath to the count of 4, 1, 2, 3, 4. Then exhale slowly to the count of 4 through your mouth, 1, 2, 3, 4. And then finish the box by relaxing or holding to the count of 4. 1, 2, 3, 4. Do what makes you feel most comfortable, which helps with relaxation. By teaching this strategy to patients, it can help them with reducing symptoms of anxiety, such as if they're having symptoms of tachypnea, tachycardia, or high blood pressure. This is a great strategy to use. Once the respiratory rate is lower, the patient's pulse and blood pressure will also reduce, which will help the patient to relax their body, and their demeanor will be more calm. Meditation and mindfulness is another strategy that you can use. To perform this strategy, advise the patient to focus on one aspect, such as drinking a cup of water. So if you can give them a cup of water and then ask them to focus all of their intention on performing one single activity. If they just focus on taking a sip of water and thinking about how it feels for the water to enter their mouth, what it feels like on their lips, what it feels like in their mouth, what it feels like to swallow the water as the water goes down their esophagus. When they focus all of the attention on this, their mind stops thinking about the things that are causing them stress. And this in turn helps to reduce their stress because their perception changes. Another strategy you could use is laughter or humor. To perform this strategy, keep a notebook handy for some funny jokes that would be found funny to patients, but would not be offensive or hurtful to anybody. So keep the humor good-natured to lighten the mood. This helps to keep the healthcare environment non-threatening to patients. Laughter helps to reduce stress and also improves connection with others by building a greater trust relationship. And always remember to smile at your patients when greeting them so they feel greater levels of comfort. The next aspect to discuss for a strategy is guided imagery. This assists patients to relax in a comfortable setting to help reduce stress-related symptoms. So provide a scenario for patients to help with relaxation. For instance, if they like going to a beach, ask them to close their eyes and imagine what it's like to be at that beach. Ask them to remember the last beach they were at and think about looking at the ocean and thinking about what the waves look like as it comes onto the shore. Think about what it feels like to have the sand under your feet. What does each grain feel like? What does the warm sun on your body feel like to your skin? Think about what you hear if you hear seagulls in the background. Think about what it sounds like for the waves as they come crashing in. When you provide a scenario for patients like this, it helps them with relaxation. Just take a brief period of time to provide a short guided imagery, and this will help the patients relax. Think about using this after a long day of work for yourself, just to kind of relax and let the day fall off before you return home. This can help nurse practitioners themselves at the end of a long day, as well as patients by teaching them how to use this technique for work-related stress.
It's great hearing how these interventions can be applied in real-world settings. Thanks for sharing. What are some additional resources that nurse practitioners can use?
Nurse practitioners can use a multitude of resources for assistance with gaining more information about how to reduce patient stress in their healthcare facility and for improvement of health and well-being. Teach patients that there are apps available that they can download onto their electronic devices. All they need to do is take their electronic device and key in stress management in the search field, and many apps will be able to be downloaded onto their personal devices to use. Nurse practitioners can review the article, again, that I authored in the February 2024 issue that I referred to previously. And they can also advise patients that they can contact their human resources department in their workplace to ask if there's any employee assistance program that they can use to help them with learning different personal stress reduction strategies. Other resources include using the website from the American Institute of Stress, which you can find online through the website www.stress.org, or on the International Stress Management Association on the U.S. website www.isma-us.org.
This will definitely help the NPs listening find the support they need. Thanks again for sharing. If nurse practitioners have questions about these strategies, how can they contact you?
Well, I can be reached by email at fels3@comcast.net for any questions or to provide workplace stress management classes. I provide in-person or virtual classes for healthcare providers, business employees, school staff, faculty, through Teach the Nurse LLC, with classes taught by myself, Dr. Denise Felsenstein.
Thanks so much for your time today, Dr. Felsenstein.
Thanks.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at The Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.